If you're considering knee replacement surgery, one thing that you need to consider is that surgery in and of itself is very invasive and can come with a lot of complications. I'm Dr. Sally with Regenexx Pittsburgh, your Southwestern Pennsylvania premier provider of non-operative orthopedics and orthobiologic injections. Cold therapy can be used for arthritic pain that's more acute. If you're very active one day and you have a lot of pain, maybe later in the evening or before you go to bed at night, ice can be significantly helpful for reducing those sharp pains that come with that arthritis and with that pain and swelling. Heat therapy may be more beneficial when there's more joint stiffness or muscle aching that accompanies the arthritis. If you've been really active one day, or if you wake up one day and there's a lot of stiffness in the joint and maybe some mobility issues, the heat can be helpful for loosening up some of that muscle, helping with a little bit of stretching activity and reducing some of that stiffness and soreness that's slowing you down. Cold therapy and heat therapy can actually be used interchangeably depending on what a patient feels.
Hi, this is Dr. Lieber from Regenexx Pittsburgh. I know that your health questions and your pain condition can be overwhelming at times, but we're happy to answer your questions either in the comment box below or just by calling your number and someone will reach out to you.
Sometimes cold therapy can be helpful for pain that's more acute after activity. Sometimes heat therapy can also be used later if the muscle still feels stiff or if there still feels like there's some irritation in the joint. The answer for which type of therapy to use is sometimes unclear and can depend on how a patient feels when they're applying the therapy. Cold therapy should usually be applied for anywhere from 10 to 15 minutes to the area that hurts. You shouldn't use cold therapy any more than 30 minutes in between each treatment. The same can be said for heat therapy. Application should be about 10 to 15 minutes per treatment, and you should not leave heat on the area of pain for too long, or it can cause problems with skin damage. The research behind glucosamine and chondroitin is good. However, some of the effects may be dependent on the patient and may depend on how much arthritis you actually have in the joint. Glucosamine and chondroitin can be helpful for joint lubrication. It can also be helpful for bolstering cartilage that's still in the joint and creating better mobility for patients. If utilized early, glucosamine and chondroitin can be a good supplemental treatment to help with improving the longevity of the joint and managing mobility and pain. In patients where arthritic change is more advanced, glucosamine and chondroitin may not have as much of an effect as if the treatment is performed early when arthritis is still minimal. Some people will take it and will experience great benefit in terms of relief and mobility. Other patients may take it and not really experience much relief at all. The safety of the supplement is very good though, so you could always try it and see if it is something that works well for you. If glucosamine and chondroitin don't help you, there are other treatment options that we have available that we can discuss to provide you with more benefit. If you're considering knee replacement surgery, one thing that you need to consider is that surgery in and of itself is very invasive and can come with a lot of complications. Another thing to take into consideration is that the knee replacement itself may not create a solution to all of the pain symptoms that you have. Knee replacement surgeries can be complicated by a number of things, such as infection or failure of the prosthesis itself, or other complications with wound healing that may cause mobility issues. There's also a relatively long recovery that happens after knee replacement surgeries that requires a lot of investment in physical therapy and improvement in mobility that suffers after the surgery itself. Unfortunately, if there are other factors that are creating pain outside of just the joint, these factors may continue to create pain for patients even after the recovery has completed. These factors can include tendon irritations or other ligament instability that may create problems with mobility and generate other issues that can cause ongoing pain. So if you're suffering with knee arthritis and somebody has mentioned to you that surgery might be a good option or even the only option for you, I would highly suggest that you look at Regenexx Pittsburgh and the non-operative treatment options that we have available for your pain. The innovative non-surgical treatments that we offer can help significantly with reducing pain and improving function without surgery or without removal of the joint or large sutures that can result in infection and poor wound healing. So get in contact with us today, visit our website or go online and fill out a candidate form. so that you can schedule an appointment with us to talk about your options.